In this video, we will discuss the levels of prevention in public health nursing. The three levels of prevention in public health are primary, secondary, and tertiary prevention. In primary prevention, the goal is to protect healthy people from developing a disease or from getting hurt. In secondary prevention, the goal is early detection. Think of screenings. These services are designed to detect and treat disease in the early acute stage. Finally, in tertiary prevention, the goal is aimed at providing services designed to limit the progression of disease or disability. Essentially, we are trying to mitigate or lessen the severity of a condition. Here are a few examples of primary prevention. First, there's education. As nurses, whether we are working in the community or at the bedside, a significant portion of our job responsibilities include patient education. When we teach our patients, they are better prepared to make informed decisions that may prevent illness, disease, or injury. Some examples of education may include teaching preschoolers how to brush and floss their teeth to prevent dental caries, or teaching patients with insulin-dependent diabetes how to draw up and administer insulin. We know that vaccinations have contributed to the decline and in certain cases, the eradication of diseases. Immunizations help to protect people from developing a specific disease. Finally, legislation or laws is another example of primary prevention. Laws such as wearing seatbelts while driving and the prohibition of smoking indoors or on hospital or school campuses aim to protect people from getting injured and developing diseases. Some examples of secondary prevention include health screenings. This is a popular intervention and can be done at your healthcare provider's office, a local health fair, and sometimes even at your local pharmacy. The goal is to detect diseases as early as possible. Blood pressure screenings, blood sugar screenings, mammograms, and colonoscopies all fall under secondary prevention. STD testing. Testing for STDs is a common type of screening. Screening for STDs is important, in particular those STDs that can be asymptomatic or have mild symptoms that may go unnoticed or unchecked, such as HIV and syphilis. TB screening and treatment and quarantining when necessary are also examples of secondary prevention interventions. Finally, we have tertiary prevention. Again, the goal is to limit the progression of the disease or disability. An example of this is managing chronic diseases. This can include an array of actions, such as attending a diabetes clinic and taking prescribed medications consistently. Rehabilitation, occupational therapy, and physical therapy are more examples. The goal of these interventions is to restore. In a support group, the goal is to provide a space for people who share similar experiences. Patients being able to talk to other patients or simply just listening and knowing that they're not alone could help them to manage their condition. Now let's apply what you've learned. Number one, Nancy is a 65-year-old woman with diabetes. Her primary care provider has recommended that she come in for her annual physical and mentions that she should consider getting the vaccine that protects against pneumonia. What is the level of prevention? This is a primary prevention. We know that pneumococcal infections can be prevented with a vaccine. Number two, aside from her annual physical exam, Nancy also sees her primary care provider once every 2 to 3 months to manage her diabetes. What is the level of prevention? This is tertiary. Nancy has diabetes, a chronic condition. Following up with her primary care provider regularly can help to limit the progression of the disease. Number three, Nancy attends a local health fair in the community. Although her blood pressure was normal the last time she saw her primary care provider, she decides to stop at one of the booths to check her blood pressure. What is the level of prevention? This is secondary prevention. A blood pressure screening will detect any abnormal values, and when that is the case, the client should be referred to see their primary care provider or have one recommended to them, or be referred to a clinic if they are uninsured. This ends our review of levels of prevention in public health nursing. I hope that this was helpful, and I'll see you in the next video.